Hello, everyone. Welcome to Healthy Living Together. Healthy Living Together is a project that was developed by McKenzie Health System in collaboration with the Sanilac County Health Department, MSU Extension, Great Start Collaborative, and Sanilac County Community Mental Health to help you on your path to a healthier life. A few housekeeping items. Just so you know, your audio is automatically muted. If you have questions, use the QA function at the bottom of your screen. This event will be recorded and a link will be sent in a follow-up email. On the agenda today is diabetes. Let's talk about it. Counting carbs and exercise. There will also be a question and answer section at the end. I am Katie O'Mara. I am the nursing director at the Sanilac County Health Department. And presenting today is Kris Kreiner, a registered dietitian and diabetes quality coordinator for McKenzie Health System.
Okay, so thank you everybody for attending today. We greatly appreciate you taking time out of your schedule to sit and meet with us today. So of course, the topic today is diabetes. We're going to talk about counting carbs and exercise. So the agenda of today, of course, we do want to define what is diabetes, what causes diabetes, and how do we manage it. So we manage it two ways. What we're going to talk about today is counting carbs and exercise. So we're just going to do some defining of the diabetes. So what happens in our body is that we do not produce enough insulin. And insulin is a natural hormone that we all produce within our bodies, or there's an inability to use the insulin to its full potential. It is found in the pancreas, and it acts like a key to open up our cells to let glucose go in to our bodies that gives us energy. So the insulin is, like I said, found in the pancreas, which has two different types of cells. Each cell has their own job. So the beta cells breaks down carbohydrates for energy and makes insulin. And then the other cell is called the alpha cell, and they help insulin work better within our body. So with diabetes, an individual does not have enough insulin or keys. So the glucose builds up on the outside of the cell. So that does not allow the glucose to get into our cell for energy. So when somebody is diagnosed with diabetes, a lot of the times the doctors will do certainly different types of blood work, but one of them would be an A1C. The A1C is an average of your blood sugars over 3 months. And so there are a couple other tests, but that's one that typically we focus on the most. So we're going to define two major different types of diabetes. There are three, but we're just going to focus on the two. The first one is type 1. So what does cause type 1 diabetes? So we can see in this slide here that our body's system fights an infection. It attacks and destroys those beta cells in that pancreas. Genes and environmental factors, such as a virus, can trigger this disease, and it is a disease. So once you have it, it doesn't go away. So what can we do to control type 1 diabetes? Well, unfortunately, with type 1, once you get it, there's nothing you can do about it, of course. And when you do have type 1 diabetes, you are solely on insulin. There is no oral medications that you can do to manage that diabetes. The other type of diabetes is type 2. And there are a lot more factors in here that we can do to help manage and control and eventually potentially keep us from getting diabetes. Having excess weight, genetics is certainly, there's not much we can do with that. That's, we get it from our parents. It's just the way it is. Being physically inactive, insulin resistance is something that happens when our body's not using insulin properly. So once again, what control do we have over this? So if we go back to these, we do have control over being overweight or having excess weight. We do have control over not being physically active. The genetic piece, we typically don't have control over that because that's passed on from our parents. And the insulin resistance typically will come from that excess weight and being inactive. So we do have control pretty much over 3 of those 4 that we can do something about. So just a little bit more definition on what insulin resistance is. It's a buildup of tolerance to an insulin, which is our hormone, making insulin or that hormone less effective in our body. Our body needs more insulin to persuade our fat and muscle cells to take up glucose. Our liver needs to continue to store more glucose, and then our beta cells eventually wear out. So over time, as our diabetes progresses, and unfortunately it is a progressive disease, once you are diagnosed with diabetes, you will always have it. Even when it is very well controlled and your A1C is at 7% or less, you still have diabetes. So once you hit that threshold of 6.5 or above, you still have that diagnosis. I've had many people ask me, well, will it ever go away? No, it does not ever go away. If people have gastric bypass, it just goes into what we call remission. So, you're still managing it, but you may not be on medication for it because you've had that weight loss. So weight loss is a huge part of managing the diabetes, which once again can be done through controlling your intake and then also being physically active. So what causes insulin resistance? So we talked about the genes. Not a whole lot we can do about that. That's just passed on from generation to generation. We see a lot in an older aged individual, a sedentary lifestyle, being overweight, and the obesity. So once again, we have control over our sedentary lifestyle. We have control over being overweight. We have control over, the obesity part. We don't have much control over the genes, and we certainly don't have control over the older age because that's just the way it goes. I mean, we're all getting older no matter how young we want to be. So we just have to learn how to, manage it to the best of our ability. And so, it's great that everybody's here with us today, learning a little bit more on how we can all work together collaboratively to manage diabetes a little bit better. So we're going to focus on carbohydrates. So carbohydrates is one of our major foods that we take in every day that gives us energy. And on the left-hand side, you can see what are they. So some people have a great understanding of what carbohydrates are, and some people struggle with that. So I want to take a few minutes to just kind of go over some of the main carbohydrates that we would eat on a day-to-day basis to just kind of get everybody an idea. So certainly they're breads, rolls, cereal, crackers, pasta, rice, milk, yogurt, and of course our starchy vegetables, our potatoes, corn, peas, winter squash, pumpkin, fruit, juice, and beans. All of those are what we consider carbohydrate foods. So why are they important? Well, they give us energy. They are actually our first line of energy that we need to get up and go and do what we do every single day. We need to eat them in portion controlled sizes, and they need to be eaten consistently throughout the day to help us manage our diabetes. So on top of taking medications, and there are some individuals that are diagnosed with diabetes that are not on medications, but are just managing their diabetes with how they're eating and being physically active. So it can be done, but once again, it's challenging. No matter how you're managing your diabetes, it's always going to be challenging. So that's what we're here for, is to do the best we can to offer up as much support as we can to individuals who have it and give you as much information as we possibly can to help you do that. So we're going to break it down even a little bit more in each food group. So our starch food group here of our carbohydrates. So if you were to take one slice of bread, that would equal around 15 grams of carbohydrates, or we're going to shorten it to the word carbs. If you ate a hot dog bun, each side of that hot dog bun equals 15 grams of carbohydrates. So that's 30 grams of carbohydrates for that one hot dog bun. Approximately 6 crackers, depending on what kind they are, would be, once again, 15 grams of carbohydrates. Now, a lot of people really don't like me when I tell them this when it comes to cooked rice or cooked pasta, a third of a cup. I get a lot of people say, why even bother? But that's just one serving. Most people are going to get more than one serving of carbohydrates in their meal. So sitting down with a dietitian and figuring out how many carbohydrate servings or grams you get per meal is very important, because some people don't really understand exactly how much they can have. So it's real important that, if you don't understand that part, to maybe, make an appointment and sit down with a dietitian, and that's something that can be worked out for you so you have a better understanding of it. So that, like I said, is cooked. A lot of people don't understand that as well. So you can have 2 servings of rice or 2 servings of pasta, but you have to count that as 2 of your whatever number of carbohydrates you and your dietitian have set in your meal plan. So milk also is considered a carbohydrate, believe it or not, because it has lactose in it, and that is the natural sugar within the milk. It does have 12 grams. I round it up to 15 to call it to just kind of round it up to that 1 carb. So it doesn't matter what color the cap of the milk is, because it has all the same amount of carbohydrates. The color of the cap just basically tells you what fat is in that milk product. Yogurt can vary. Typically, it's around a 6-ounce cup, or I'm sorry, 6-ounce container. And it depends on if it's flavored with fruit. So you're really looking for right around 15 grams of carbohydrates per 6-ounce container of yogurt. That would be a really good snack, because it also has protein in there, and typically most of it has a healthy fat, as long as you're not getting the full fat yogurt. And the protein and the fat work very well together with that carbohydrate to help maintain good blood sugar control. The protein and the fat both take longer to break down, so they work very well with that carb to, like I said, once again, maintain good blood sugar control. So we're going to kind of get to our potatoes. Doesn't matter how they're prepared, how they're cooked, but it does really matter on the size and the amount. So a 1/2 cup of mashed potatoes is 15 grams of carbs. 1/4 of a large baked potato is 15 grams of carbohydrates, and a 1/2 cup of sweet potatoes is 15 grams of carbohydrates. So some people could have the same amount of potatoes and check their blood sugars 2 hours after they ate them. And one person might be right on the nose with their blood sugar numbers, and the other one might be really, really high. We break down carbohydrates differently. So some foods may be a little rougher on our body, so to speak, and we may have a harder time getting our blood sugars under control, depending on the type of carbohydrate that we consume. So the starchy vegetables, we have corn. A 1/2 cup is 15 grams of carbs. Peas, once again, a 1/2 cup, and winter squash is a 1/2 cup. So like I said, most of your starchy vegetables is based off of a 1/2 cup per serving, which equals 15 grams of carbohydrates. Fruit, that varies. Some people have come up to me and say, oh, I can't have grapes because they're just too sweet. I've been told I can't have grapes. Well, there's no foods that an individual that has diabetes that you cannot have. Okay, so that's one of the reasons why I was sitting with a dietitian and or going through a diabetes program, is very important because in my program, we really sit down and tell you what how you can make this food fit into your meal planning. So for peaches or pears, a half a cup of canned is 15 grams of carbohydrates. And then for berries, it depends. It depends on the type of berry, but most of them are 3/4 of a cup to 1 1/4 cups of berries. It just kind of depends on strawberries, blueberries, blackberries, raspberries. A half of a banana is 15 grams of carbohydrates. So our grapes are pretty good size, and 16 small grapes is what they consider a portion size. Well, our grapes are not even close to being small. So if we cut those in half, right around 8 large grapes would probably be pretty darn close to 15 grams of carbohydrates. Once again, some people are saying to me, why bother? I want to sit there and eat more than that. Okay, that's fine. But if you want to eat 30 grams of carbohydrates just in grapes, that's fine. But just bet that your blood sugars are going to be higher. Some people, it might affect a little bit more than others. Half a cup of unsweetened applesauce would also be 15 grams of carbohydrates. For juices, we certainly want individuals to pick more of the natural juices versus anything that has extra, sugar and stuff added to it. Typically right around a half of a cup or a third of a cup, depending on the juice, would be right around 15 grams of carbohydrates as well. And then beans, believe it or not. So pork and beans, or any color of your beans, pink, purple, blue, whatever color you eat, the white ones, 1/4 of a cup to a half of a cup is typically right around 15 grams of carbohydrates. So the good thing about the beans is they also count as a protein. So these are highly recommended, especially for our individuals that have diabetes, that have high cholesterol levels. So the cholesterol comes from our animal protein sources. So these would be good substitutions or foods to consume if you have high cholesterol levels. And we want you to kind of cut back on some of the animal products that you're eating. But once again, we do have to be careful with these because they do have the carbs in them, but they are a good protein source. So any of your plant-based proteins are very good for you. Just be careful that they do have to be counted as your carbohydrates in your meal planning. So some people might ask me, well, how many carbs should I have a day? That is a very good question. It is individualized based on each individual, okay? Some of the questions that I might have to that person is weight loss a goal for you? Is lowering your A1C a goal for you? Is healthy eating a goal for you? So these just might be a few questions that might pop up during my assessment with an individual. So we're going to kind of break this down a little bit. So if we're looking for weight loss for a female, we're looking at anywhere between 30 and 45 grams of carbohydrates per meal. And then for a gentleman, we're looking between 45 and 60 grams per meal. Now, you can also throw around 15 grams of carbohydrates plus a low-fat protein source in there for snacks as well. So some examples would be like a low-fat cheese sticks with a serving of crackers, a yogurt with around 7 grams of protein, and then, of course, that yogurt should be right around 15 grams of carbohydrates. So those are just kind of some, recommendations for the weight loss. If anybody's interested in getting into more detail, like I said, getting with a dietitian would be the best thing for you to do. So just a little take on this: moderation of food intake is a key factor to managing one's diabetes. We find that, especially in the classes that I teach, that the portion control is probably the biggest thing that I really focus on in our program as well. So that kind of leads us here to our plate here. So this is kind of our breakdown. Our recommendation is a 9-inch plate. This is kind of broken up for both an adult and for a child, but the 9 inch is what we would recommend. At least half of that, some type of what we would call a non-starchy vegetable. So in this case, you're seeing at the very top, you've got kind of like your salad fixings or broccoli. There's a little fruit off to the left-hand side. I would typically have that off maybe into another bowl. Some people don't typically have their salad on their plate. I personally don't. Mine would be in a separate bowl, and that's fine. If you wanted to do like broccoli, cauliflower, and carrots together, you could do that as well. Those would be considered your non-starchy vegetables. But your starchy vegetable, of course, you can see in this case, they have rice. That's just a starch, not necessarily starchy vegetable, but you could have your peas or your corn on there too. You could have your potato. A quarter of it should be a lean protein. So in this case, there is the chicken breast with no skin on it. So, we're looking, when you're putting your plate together, we're looking to make sure that we're counting up our carbohydrates as well. So if we were to look at this plate, what counts as that carbohydrate certainly would be your rice. So that should measure out to 1/3 of a cup cooked. So that's one of your carbohydrate servings, or 15 grams of carbohydrates. Then if we go up to your salad, if it's 3 cups or less, you do not need to count it as a carbohydrate. If it's 3 cups or more, then you count it as a carbohydrate serving, because every half cup serving of a non-starchy vegetable equals 5 grams. So if 5 times 3 is 15, so now you have to count it. But anything under that, you don't have to count it. So if you think you're going to eat 3 cups of salad at one setting, then you have to count it as one of your carbs. If you're eating less than that, you do not have to count it. Might have some questions on salad dressing. I call them leaded and unleaded. So you have your full fat salad dressing, and then you have your fat free. When you go from your full fat down to your fat free, they're going to take one of the flavorings out of that to make it the fat free. They're taking the fat out. When they take the fat out, they're either going to add sugar or salt into it to try to help keep some of that flavor in there, because they took the fat out. When they do that, if you look at the leaded, or I call it the full fat salad dressing, and they go down to the fat free, you're going to see that there's going to be less carbohydrates in the full fat and more carbohydrates in the fat free. So if you can try to find that your palate in some form or fashion likes the light, so the one in the middle, that probably would be fairly comparable, I think. And maybe hopefully most people would like at least the light type salad dressings. Certainly any salad dressing that you can see through is going to be healthier for you than the ones that you cannot see through. The ones that you cannot see through certainly are going to be the ones that are going to be higher in fat, even the light ones. The fruit is typically around half a cup. That would be, depending on what it is, right around half a cup is usually a good judge to try to keep your fruit around. That is right around 15 grams of carbohydrates. So if that fruit measured up to a half a cup of mixed, whatever you want to put together, there's another 15 grams of carbohydrates. And let's say this salad was only maybe 2 cups. Okay. So now you're only at another 10, grams there. So now we're at 40 grams of carbohydrates. So that's not too bad. If we're looking for a 60-gram carbohydrate meal, we're a little short. If we're looking for a 45-gram carb meal, we're probably right on. We don't need to add anything more. The milk, the 6 ounces, typically we want to do an 8 ounce is what we can consider right around 12 grams or closer to the 15. That would be closer for us to get to that 60 if we added that 8 ounces of milk. So this is pretty much what we're looking for. We want to do a quarter of the plate, some lean protein, a quarter, some type of a starch, and then at least half the plate, that non-starchy vegetable. Like I said, we could put the fruit on there too, or, we could maybe take the fruit off and throw on a small biscuit or a small dinner roll. We could even have 1 slice of bread if we wanted to. So, those are just kind of some things to think about, and how you can kind of divide up your plate. But the 9-inch plate is what we're really pushing for, because you can get all this on there and it fills up your plate and makes it look like you have a lot of food on there. When you start going to that larger plate, your eyes get bigger, your stomach's probably looking like I'm hungry. You put more on there, and that's when we really start getting ourselves into trouble. So we're really trying to focus more for that 9-inch plate. So we kind of want to now focus a little bit more on the diabetes and the exercise part of this. So our recommendation is 150 minutes per week, 30 minutes per day. So this 30 minutes can be certainly split up in 10-minute increments. Don't have to do all 30 minutes at one time. And the recommendation is no more than 2 consecutive days without exercise of any kind. So we certainly recommend as much aerobic exercise as we possibly can. Anytime we can get our heart rate up, it's building our heart muscle. It's certainly very beneficial for us. But we also want some strength training. That's certainly going to help build up our muscles. And certainly we all know as we get older that, we do lose muscle mass. And then our balance exercise, once again, as we get older, we do lose a lot of our balance as well. So anything that you can do of any of these 3 is certainly going to be very beneficial. You can find just about any type of safe exercises on a YouTube video. There's walking videos. Leslie Sansone is one that I've done in the past, and I continue to do. You just put her name in there and you can pull up many of her videos that you can just do safely in your own home. So some of the aerobic exercises, certainly walking at a pace that increases your heart rate, but you're still able to carry on a conversation with somebody. Certainly swimming, cycling, running, those are going to be a little bit more, extreme. Strength training, working with exercise bands or weights or some type of weight machine. Balance exercises like Tai Chi, yoga, standing on your toes, leg lifts, that type of thing. Kind of gives you that balance. You can certainly use, chairs, but when you're trying to get your balance under control and in better shape, trying to do it without any type of help is certainly a better goal. So any form of exercise is better than none at all, really. So managing diabetes, once again, we're looking for those consistent carbohydrates throughout the day. So skipping breakfast and having very little for lunch and then having a big dinner is not what we're looking for. We want that consistency. We need you to have some carbohydrates for breakfast. We need you to have some for lunch, and we need you to have some for your dinner or supper. Consistent exercise daily and weekly. So we've got to have something that you're doing throughout the week. And then certainly taking your meds as prescribed daily and weekly. So if you're not on medications, that's even better. But if you are, it is very important that you stay on your medication regimen as well. So this is just a little bit on the program that we have here at McKenzie Health System. It's our Diabetes Self-Management Education Service. It is offered here at the hospital in a group setting. You need a referral from your primary care provider in order to attend. The service is covered by most insurances, and there may also be a copay, just kind of depending on your insurance and where you're at in the time of the year with your insurance. It is a 10-hour program. There's 1 hour that is an individual appointment, and then there's 9 hours of class. We break that up 1 day a week, and it's typically 3 hours in that 1 day. We have a staff of myself, the registered dietitian. I'm also the diabetes quality coordinator. So I oversee the whole program. We have a registered nurse, a registered pharmacist, a physical therapist, and a social worker that all attends the classes, not all at one time. They all have their own sections, but I'm at every class. So we're all have our own expertise that we bring to the programs. It's just very dear to my heart that we have this many people and their expertise that they can bring to support the community. Some of the topics that we cover certainly are healthy eating, being active, taking medications, monitoring our glucose levels, covering the complications of managing diabetes or lack of managing diabetes, lifestyle and healthy coping, diabetes distress and support, and then certainly goal setting and support. So this is my information. Like I said, I am here at McKenzie Health System on Monday through Thursday. I'm available. Here's my phone number. Once again, my name is Kris Kreiner. I'm a registered dietitian here, the diabetes quality coordinator, providing services to the community on diabetes education. So there's just a couple of references that I had on some of the information that I provided to you today. So just the last thing I kind of wanted to say was the way to get started is to quit talking and begin doing. So that to me is very, very important. You know, if you're struggling with your diabetes, or you know somebody that is struggling with managing their diabetes and they've never gone through a diabetes program before, you know, I'm going to speak very highly of the program. I've been doing this for over 10 years. And the programs are very important for an individual to learn everything they possibly can about managing their diabetes, because it does change over years, and medications are changing. We're getting new ones. We're losing some. You know, there's just so many different things that you can learn to help you manage it. And really, you are your own patient advocate. You're the only one really that can manage it. We can talk all day long. You can get medications all day long, poke yourself all day long, but really you're the one that's you know, managing your diabetes. So now we're pretty much at the question section. So we'll kind of let Katie take it from there.
Thank you for that great presentation, Kris. Again, if you have any questions, enter them in the Q&A function at the bottom. I do have a couple that I will start with here. Is one exercise better than others for blood sugar control?
So any exercise is good. Doesn't really matter which one's better than the other, to be honest with you. We are just very proactive of any movement that you can do is certainly better than none. We do understand that some of our elderly populations do have some restrictions. So let's say you've got a bad hip or a bad knee and you really can't do a bunch of walking. If you can just sit in your chair, do some type of chair exercises, some upper body. If you've got, you know, bad shoulders and you can't do that, but you can do some lower body, anything, any type of movement is what we are really looking for that can just help you with your blood sugar control. So I would say anything that you can do, we would be blessed to help you with in any form or fashion that you would need support with.
Next question. How many calories do I need to promote weight loss?
So the American Diabetes Association supports, it depends on if male or female. So for a female, we are looking at between 1,200 and 1,500. And for a male, it'd be between 1,500 and 1,800 is what we are looking for weight loss for our individuals with diabetes.
I have one that is not a question, but a statement. You should tell people about McKenzie wellness classes like Aqua.
Okay.
Are you able to speak to that at all?
I think we've had that. I don't know if we have that on, it might be on the website. I'm not sure if we have that posted. I'm sure that they have it posted somewhere on the website, or I'm sure we do somewhere. I'm not that familiar with it because I don't do anything with it. So, but we definitely can make sure that that's, yeah.
I can help out with that. So we do have classes in Lexington, Sandusky, and some of them are year-round. We also have aqua aerobics classes here in Sandusky. You can find them on our McKenzie website. You're going to look under education and wellness, or you can just reach Nina Barnett directly and she'll be able to assist you with that.
Thanks, Nina.
Welcome.
Okay, next question. Can you explain how protein and fat affects the blood sugars?
So they do have a slight impact about 2.5 hours after you eat a food with protein. You have a slight impact on your blood sugars. You have to eat quite a bit of protein for it to really have a major impact. And then your fats about 3.5 hours after you consume it is when you have an even less impact on your blood sugars. But when you consume those along with a carbohydrate, they do all work together to help get a good blood sugar control. So you don't have such high spikes in your blood sugars. So that's why I'm not an advocate for the keto diet, where you're cutting out your carbs or taking in minimum carbohydrate foods. So my goal as a dietitian is to teach our participants of our program the portion control and making sure that they're getting consistent carbohydrates and eating healthy lean proteins and healthy fats in portion controlled sizes, so that all three of them are working simultaneously or together to help maintain good blood sugar control. So they do have a small impact on your blood sugars, but not like the carbohydrates do. And that's why we focus that so much on the carbohydrates, because of their high impact on the blood sugars.
I actually had a question myself. For the diabetes education program there at McKenzie, does the referral, can that come from any primary care provider, or does it have to be a McKenzie provider?
Any primary care provider.
Thank you. And I am seeing no more questions in the Q&A section. Oh, here comes one right here. Okay. Hold on, I'm trying to pull it up here. Does drinking pickle juice in the morning have any benefits for, that's all I can see, I'm assuming blood sugar control?
I'll be honest with you, I have no idea, but I have a coworker that she told me her husband did it and he has good blood sugar control. So I have no idea. I really don't know what that does. The only thing I can think of is that it may affect his blood pressure or her blood pressure because of all the salt in there. I have no idea if it does anything for blood sugars. So I just actually, it was kind of funny you brought that question to the table, because I just, like I said, had a conversation with a coworker, and her husband did try that and had some luck with bringing his blood sugars down. So I wish I had an answer for you, but I don't. I have no data supporting that it does anything for the blood sugars.
Anyone else have any questions they want to throw in there before we wrap things up? All right, I'm not seeing any additional questions. I do want to mention that our the next Healthy Living is scheduled for March 20th. The topic is fishing in Sanilac County and is it safe to eat?